Chapter 13, Assessment of Personality. An introduction to personality assessment. Personality assessments tend to be categorized as structured or unstructured, also referred to as objective and projective assessments, respectively. Structured assessments are typically more standardized measures with forced choice formats. Unstructured assessments are those that seek responses to ambiguous items or perhaps tasks to showcase personality traits or states, also known as the projective hypothesis. Objective personality assessments tend to be constructed using one of four methods: logical content, theoretical, criterion group, or factor analysis. The logical content method involves the test developer identifying items that correspond with the apparent domain or content of the characteristic being assessed. The theoretical method involves developing items that are aligned with an underlying construct. The criterion group method refers to developing items that relate well to a group of individuals known to possess a particular characteristic. Then the criterion group is compared to a control group on those items, and items that distinguish the groups are retained. The factor analytic method involves the test developer using a statistical procedure, a factor analysis, to review shared variance among items to detect latent constructs or factors. Popular structured personality assessments. There are two assessment inventories clustered as the Minnesota Multiphasic Personality Inventories, each accompanied by a restructured form: the Minnesota Multiphasic Personality Inventory 2, or MMPI-2, the Minnesota Multiphasic Personality Inventory 2 Restructured Form, MMPI-2RF, the Minnesota Multiphasic Personality Inventory Adolescent, or MMPI-A, and the Minnesota Multiphasic Personality Inventory Adolescent Restructured Form, MMPI-ARF. T-scores of 65 or higher are clinically significant, and scores between 60 and 65 can indicate possible psychological problems. The MMPI-2 contains 10 clinical scales that help to differentiate people within a particular psychiatric diagnostic category. These scales are as follows: hypochondriasis, depression, hysteria, psychopathic deviant, masculinity femininity, paranoia, psychasthenia, schizophrenia, hypomania, and social introversion. Validity scales are also available to detect response sets for test takers, and the supplementary scales of anxiety, repression, and ego strength are also useful to evaluate. In addition to reviewing high and low scores on the clinical scales, counselors need to attend to particular items that would indicate imminent risk of harm to self or others. The MMPI-2RF is a briefer alternative to the MMPI-2. The MMPI-A is similar to the MMPI-2, but it's tailored for use with adolescents ages 14 to 18. MMPI-A does include 4 unique content scales: school problems, low aspirations, alienation, and conduct disorder. The MMPI-ARF is the most updated personality assessment for adolescents and is a briefer alternative to the MMPI-A. The Milan Clinical Multi-Axial Inventory 4 and its version for adolescents, the Milan Adolescent Clinical Inventory, conceptualizes personality styles on 3 levels: normal or adaptive functioning, abnormal, moderately maladaptive, and clinical. The former contains 15 personality disorder scales and 10 clinical syndrome scales. The latter contains 27 scales and 3 clinically relevant categories. The Milan Index of Personality Styles Revised is a personality inventory designed to evaluate normal adult personality. It contains 24 scales and 4 validity indices to provide information on 3 dimensions of normal personality: motivating styles, thinking styles, and behaving styles. The Personality Assessment Inventory is a tool used with adults ages 18 years or older. It contains 22 scales, clustered as one of 4 scale types: validity scales, clinical scales, treatment scales, and interpersonal scales. The clinical scales parallel many of the MMPI scales and can be categorized as neurotic spectrum, psychotic spectrum, and behavior disorder scales. The treatment scales provide clinically relevant information related to interpersonal problems. Other personality assessment inventory scales exist, such as the Personality Assessment Inventory Adolescent, the Personality Assessment Inventory European Spanish with Norms, and the Personality Assessment Screener. The Myers-Briggs Type Indicator, or MBTI, is a measure of normal personality characteristics using 8 scales, 4 pairs or dimensions, and it's based in Carl Jung's theory. The first dimension is extroversion versus introversion, E or I, which relates to individuals' preference for where they draw or focus energy. In other words, toward people or the outer world, or internally or toward their inner world. The second dimension is sensing versus intuition, S versus N, which refers to how individuals perceive information. In other words, through their 5 senses or through indirect perception. The third dimension is thinking versus feeling, T versus F, and relates to how individuals judge obtained data. The fourth dimension is judging versus perceiving, J versus P, which relates to how individuals opt to interact with the outside world and implement decision-making. An alternative to the MBTI is the Keirsey Temperament Sorter 2, with items and dimensions that are similar to the MBTI. California Psychological Inventory, CPI 434, and its shorter version, CPI 260, they assess an individual's positive, everyday personality attributes, referred to as folk concepts. The scales include dominance, capacity for status, sociability, social presence, self-acceptance, independence, empathy, responsibility, socialization, self-control, good impression, communality, well-being, tolerance, achievement via conformance, achievement via independence, intellectual efficiency, psychological mindedness, flexibility, and femininity/masculinity. These concepts or scales are placed in an interpretive 3-dimensional model. The 16 Personality Factor Questionnaire includes 16 scales and 5 global factors: extroversion, anxiety, tough-mindedness, independence, self-control. The global factors are similar to the Big 5 factors. There are 2 additional versions of the 16 Personality Factor Questionnaire. There's the High School Personality Questionnaire and the Children's Personality Questionnaire. The NEO, or NEO, Personality Inventory Revised, was explicitly designed to measure the Big 5 personality factors: neuroticism, extroversion, openness, agreeableness, and conscientiousness. There's also a shortened version, the NEO 5 Factor Inventory. The Cooper-Smith self-esteem inventories are used to measure individuals' self-evaluations as they relate to social, academic, family, and other personal experiences. They consist of 3 forms: the school form and school short form for ages 8 to 15, and there's the adult form. The school form provides 6 scores: a total self-esteem score, subscale scores related to peers, parents, school, and personal interests, and a lie scale score. The school short form and the adult form only have a total self-esteem score. The behavioral academic self-esteem tool is a rating scale that can be used to triangulate self-reported information reported on the Cooper-Smith. The Tennessee Self-Concept Scale, which includes 2 forms for ages 7 to 14 as well as ages 13 and older, is a popular measure of self-concept. It includes 14 scales. The Piers-Harris Children's Self-Concept Scale is similar to the Tennessee Self-Concept Scale and is tailored toward individuals in grades 3 through 12. Popular unstructured personality assessments. Unstructured or projective tests allow for multiple responses toward ambiguous stimuli. These responses may be used to infer information about an individual's personality. Although these tests are reported to be minimally used in counseling professions, they do possess clinical value. Projective techniques can be classified in 5 ways: association to ink blots or words, story construction or sequences, a sentence or story completion, picture arrangement or selection of verbal choices, and a drawing or play techniques. The Rorschach ink blot test is the most widely used projective test in the helping professions. It involves a series of 10 ink blots, and responses are categorized according to the location of the response on the ink blot, the feature that determined the response, and the content of the response. Exner's comprehensive system is the most popular scoring scheme used today. The thematic apperception test and other story construction techniques such as the children's apperception test and Tell Me a Story provide opportunities for a test taker to look at cards and make up and detail the sequence of the story. The thematic apperception test includes 30 black and white cards, 20 of which are used during test administration. Most cards are drawings of people. The children's apperception test consists of 10 pictures to use with children ages 3 to 13 and uses animals in the drawings. Tell Me a Story is intended to be an adaptation of thematic apperception tests for use with diverse populations. The Rotter Incomplete Sentences Blank consists of 40 sentence fragments written in the first person. A single overall adjustment score can be calculated, although counselors can use responses to initiate session content on a variety of topics. The Draw a Person test, developed from the Draw a Man task, involves presenting a child or adolescent with the task of drawing a person using paper and pencil. Given the psychometric concerns with the technique, counselors should integrate the technique into their overall assessment of the presence of emotional and behavioral problems. House Tree Person is a projective drawing technique that relies on a child drawing a house, a tree, and a person, and describing the features of each. Health and lifestyle inventories. Given the importance of wellness, it's important for counselors to continually evaluate individuals' wellness. The Battery for Health Improvement 2, and its shortened form, the Brief Battery for Health Improvement 2, can be useful for identifying psychosocial factors that can serve as barriers to health improvement or injury recovery. The Coping with Health Injuries and Problems inventory is useful for exploring what coping strategies a client is using to try and improve his or her health and wellness. The Wellness Evaluation of Lifestyle, WEL, and its briefer forms, the 4 and 5 factor WEL, are designed to measure 5 lifestyle tasks and 14 dimensions of wellness. The Lifestyle Assessment Questionnaire can be used to evaluate lifestyle in 6 areas: